Hi, my name is Dr. Larry DiDomenico from Ankle and Foot Care Centers. I'm going to talk to you today about hallux valgus deformity, also known as bunion deformities. Oftentimes, we get many different requests to discuss bunion deformities, how it's treated, when should it be treated surgically, what is the follow-up period if a surgical procedure is done, and what type of procedure should I have. So here is a clinical photo of a patient of mine who had a bunion deformity. This is a weight-bearing photo, and what this demonstrates is this large area which is called the bunion. Many patients will think it's a growth, but it really is not a growth, but it is the metatarsal head of the first metatarsal head moving medially or inward, if you will. And what happens is the toe goes outward, or as we call laterally, and it also rotates. As you can see, the nail here is not parallel to the ground, such as these toenails, for example. So this really has a three-plane deformity. It makes this a complex problem to repair. So this is the patient's radiographs preoperatively. As you can see, the first metatarsal should be parallel, such as second, third, and fourth, and the fifth. And so the problem is that this bone is deviated this direction and causing this bump. And by doing that, that also causes this great toe to go in a different direction, causing this pain, pressure, and changes at the first metatarsal phalangeal joint where patients have this bunion deformity develop. This is another view of the patient preoperatively in the OR suite. And again, one can see the significant bunion deformity without weight bearing and a lateral deviation of the left great toe. This is our patient postoperatively after he has recovered. What we used here is called a Lapidus bunionectomy procedure, which historically has been keeping patients non-weight bearing for 6 to 8 weeks in a cast. Because of the technology changes and the way we've done this procedure, we now are able to ambulate our patients essentially the same day with a walking boot, and they can be relatively functional relatively soon after surgery. For example, you can see the metatarsal now is parallel and aligned with the second, third, and fourth metatarsal, and you can also see the great toe is square to the ground and rectus or straight, if you will. By doing this procedure, it becomes a cosmetic procedure, relatively speaking, for a big bunion, and number two, it's a much safer procedure for the patient. The third thing is the patient becomes much more functional much sooner, and it's safer for the patients to be more functional earlier on after having this type of procedure. This is the patient post-operatively in our clinic, and you can see the toe is relatively straight, the foot looks more natural, and the only incision is right here along the base of the first metatarsal. It's relatively small and should fade in time. So by doing this procedure, we can remove the whole host of potential complications from patients after this type of procedure. As with all patients, cases are evaluated individually and treatments are tailored to your specific needs. Please contact us at Ankle and Foot Care Centers to discuss your treatment options. Thank you.